Hello everyone, I am Jay and you are watching Medical Yes. In this video we'll be discussing about edema and effusion. These two are very common hemodynamic disorders of our body, and hopefully in this video you'll get to know everything that you need to know about the pathophysiology of these two conditions. So let's get started. What is edema? Edema is nothing but the abnormal and excessive accumulation of fluid in the tissue spaces of our body. Edema is generally a result of the cardiovascular, renal, or hepatic dysfunction. So in this picture, I hope you can appreciate that this leg is swollen. And this leg is swollen because there is excessive and abnormal accumulation of fluid in the tissue spaces of the leg. This leg right here is also swollen. The reason is the same, but I hope you can see this pit right here, and because of the formation of this pit, it's given a different name, a special name known as pitting edema, about which we'll be discussing later on. What is effusion? Effusion is the abnormal accumulation of fluid not in the tissue spaces. Effusion happens in the body spaces or the body cavities. For example, the pericardial cavity or the pleural cavity or the peritoneal cavity. Now, just like edema, effusion is also generally a result of the cardiovascular or renal or hepatic dysfunction. Examples of effusion would be pleural effusion, also known as hydrothorax. A picture of the same is this one. You can see that fluid has got accumulated inside the pleural cavity. Hence, it's a picture of pleural effusion. Another example of effusion is pericardial effusion, in which the fluid gets accumulated inside the pericardial cavity, as is shown in this picture right here. So it's pericardial effusion. Another example of effusion is peritoneal effusion, in which the fluid gets accumulated inside the peritoneal cavity. Now this one is given a special term known as ascites. Ascites is a very important and very commonly used term, so make sure you know what ascites means. Now, before we move on to discuss what actually causes edema and effusion, we would first want to know how the vessels of our body normally function. So there are two main pressures which are responsible for maintaining the movement of fluid in and out of the vessels of our body. These are the vascular hydrostatic pressure and the plasma colloid osmotic pressure. Suppose this is a blood vessel. It has got blood plasma and the plasma proteins in it. Now the blood plasma exerts a pressure, outward pressure, on the walls of the vessel. This pressure tends to push the water and salts from inside the vessel towards the outside of the vessel. And this pressure is nothing but the vascular hydrostatic pressure. The second kind of pressure is the plasma colloid osmotic pressure. Now, it is a kind of osmotic pressure which is induced due to the presence of plasma proteins in blood. And this pressure tends to pull the water and salts from outside into the vessel. An important point to remember is that since albumin is the most abundant plasma protein, so it is also the one which is majorly responsible for the induction of this plasma colloid osmotic pressure. Now, you'll be able to understand this better with the help of this diagram from Guyton. This right here is the capillary hydrostatic pressure which tends to push the fluid out of the vessel. This one is the plasma colloid osmotic pressure which tends to pull the fluid from outside into the vessel. There are some other pressures as well which play a minor role in maintaining the movement. These are the interstitial fluid hydrostatic pressure which tends to push the interstitial fluid into the vessel. And then there's interstitial fluid colloid osmotic pressure which is induced by the proteins present in interstitial fluid, and it tends to draw the fluid from the capillary into the interstitial spaces. So to summarize, the capillary hydrostatic pressure and the interstitial colloid osmotic pressure, these two promote extravasation of the fluid, which means the outflow of the fluid from the vessel, while plasma colloid osmotic pressure and the interstitial fluid hydrostatic pressure, they promote inflow of the fluid into the vessel. So these oppose each other. Now normally what would happen is that all these pressures are going to balance out each other in such a way that there would only be a small net movement of the fluid into the interstitium outside the vessel. Normally, there is only a small net movement of fluid from the vessel into the interstitial spaces. Now this fluid which is leaked out of the vessel, this fluid is drained back into the normal blood circulation by the lymphatics. So whatever fluid leaks out of the capillaries, it is taken up by the lymphatic system of our body and it is drained back into the main circulation of our body by the lymphatic system. So what exactly goes wrong for edema to occur? In edema, what can happen is that the hydrostatic pressure, which tends to push the fluid out of the vessel, it can get increased. What can also happen is that the plasma colloid osmotic pressure, which tends to pull the fluid back into the vessel, it can get decreased. So both of these conditions will ultimately lead to increased movement of fluid out of the vessels. It's logical, right? If the pressure that tends to push the fluid out gets increased, so there will be more movement of the fluid out of the vessel. And the pressure which tends to draw back the fluid into the vessel, if that is somehow decreased, it is going to lead to more of the fluid staying in the interstitial space only. Now, if the lymphatic system, which is responsible for moving this fluid back into the circulation, that lymphatic system is somehow unable to drain this excess fluid, so this fluid is going to stay accumulated inside the interstitial spaces and this is nothing but edema. That is how edema occurs. So there are two main types of edema: inflammatory edema and non-inflammatory edema. Inflammatory edema, as you can probably tell, will be seen in inflammation. It may be acute or it may be chronic as well. Non-inflammatory edema is seen in conditions like heart failure, renal diseases, hepatic diseases, or nutritional disorders. Now, the edema fluids in both these cases are given two different terms. Inflammatory edema fluid is known as exudate, while non-inflammatory edema fluid is known as transudate. Now, the way you can remember this is, see, I is a vowel, so is E. So inflammatory edema, exudate, while N is a consonant and so is T. So non-inflammatory edema, transudate. Now let's see the differences between exudate and transudate. So as I've already told you, exudate is seen in inflammatory edema, right? And transudate is seen in non-inflammatory edema. Now what happens in inflammation? We all know that there is increased vascular permeability due to formation of gaps in between the endothelial cells of the lining of the vessels, right? So because of this increased permeability, that is why edema occurs, because fluid moves out. So that is the reason why inflammatory edema occurs, while non-inflammatory edema occurs due to an imbalance between the different kinds of pressures that maintain the flow of fluid in and out of the vessel. Now, as you can probably guess, since in inflammatory edema there is formation of gaps in between the cells lining the endothelium of the vessel, so along with the fluid, even the plasma proteins present inside the vessel, they also find a way to move out of the vessel into the interstitium, which is why the protein content of exudate is high. While since there are no gaps formed in case of the non-inflammatory edema in the endothelial lining of the vessel, so the proteins do not have a way out, which is why the edema fluid is low in protein content. Now, along with these plasma proteins, the coagulation factors also move out in case of inflammatory edema, which is why this interstitial edema fluid, it is going to have the clotting factors in it, which is why it is going to be easily coagulable. The opposite will be happening in case of non-inflammatory edema. Because there is no gap for the clotting proteins to move out, so the edema fluid will not have the clotting proteins, which is why it is non-coagulable. Similarly, due to the gaps present, many of the cells will find a way out. Hence, the exudate will have many cells in it. While in case of non-inflammatory edema, there are no gaps, so not many cells move out, and hence the transudate has a few cells. Now, obviously, since the exudate has so many things in it, so the specific gravity of exudate is high, while transudate as compared to exudate will not have as many things in it, which is why its specific gravity is low. One thing to remember is that the glucose content of exudate is low, while that of transudate, the glucose content is same as that of plasma. This is an important point to remember. Otherwise, exudate has a cloudy color. Why? Because it has so many things in it, right? While transudate does not have those many things, so it's kind of translucent or straw colored. Examples of these two kinds of edema fluids, example of exudate will be pus, purulent exudate. While transudate, the normal edema fluid in congestive heart failure or renal or hepatic diseases, protein malnutrition, all these are transudates. So as you can see in this diagram from Robbins, exudate is seen in inflammatory edema, so there are gap formation in the endothelial lining, which is why not only the fluid but also the proteins leak out, and hence exudate is protein rich. While in transudate, because it happens in non-inflammatory edema, so the endothelial lining is intact and there are no gap formations. So the proteins do not have a way out, only the fluid leaks out, which is why there is only fluid leakage. Now, what are the different causes of edema? Edema can occur because of increased capillary hydrostatic pressure, due to decreased plasma osmotic pressure, due to sodium and water retention in our body, due to lymphatic obstruction, or even due to increased capillary permeability. So now we'll discuss them one by one. The first one is increased capillary hydrostatic pressure. Now, it is generally seen in disorders that impair the venous return. Examples of edema caused by this would be edema of cardiac diseases. For example, congestive heart failure. In this condition, the heart does not do a great job at pumping the blood in overall body tissues, which is why the blood gets congested in the veins and ultimately the fluid leaks out, leading to edema. Widespread edema is seen in congestive heart failure. In constructive pericarditis, edema can be seen. Ascites is another example, which is nothing but peritoneal edema, very commonly seen in liver cirrhosis. It's a very common cause of ascites. Even in passive congestion, which means if this is a vessel and it gets blocked somehow due to internal reasons or due to external pressure, so the fluid gets retained in this part, right? And ultimately it will leak out, causing edema. So passive congestion, which may happen in thrombosis, DVT, which is deep venous thrombosis, or due to external pressure like pregnant uterus or tumors pressing on the veins. This may also be due to postural edema, which is gravity dependent. Say a person stands for a very long time, so he is very likely to see edema in his legs. If a person is bedridden, so his pelvic region is more prone to edema. Second cause of edema can be decreased plasma osmotic pressure. Now remember, the plasma osmotic pressure is due to the plasma proteins which are present in the blood. Now, if there somehow the number of these plasma proteins gets reduced, that is going to lead to decreased plasma osmotic pressure. So this is due to hypoproteinemia, that is reduced number of proteins in the blood, and mainly albumin, because that is the most important and the most abundant one. So this reduction can be caused by either reduced synthesis, that is they are not being made in the first place, or it can be due to excessive excretion. So that is, they are being removed from the body excessively. So examples of this would be reduced synthesis, that is in protein malnutrition, when the body is not getting enough protein intake, as is seen in the patients of kwashiorkor, that is protein malnutrition. And also in liver diseases, because see, liver is the place where these most of the plasma proteins are synthesized. So say there is cirrhosis of liver, so that is going to impair this function of liver, and there will not be enough synthesis of these plasma proteins, leading to hypoproteinemia, leading to edema. Now, protein may be formed in adequate amounts, but there may be some disorder that will lead to excessive excretion of those proteins from the body. For example, in renal diseases like nephrotic and nephritic syndrome, or in protein losing enteropathy. These are the conditions in which the protein will be lost from the body excessively. Third cause of edema can be excessive salt and water retention in our body. See, always remember this point: whenever there is retention of salt somewhere, it is always going to lead to retention of water along with it. So there is obligate retention of water with salts. Now this retention will always lead to increase in both hydrostatic pressure and decrease in the osmotic pressure. Why so? Because since there is increased amounts of water, so volume will be more, which will lead to increased hydrostatic pressure. And since there is more water, so it will lead to dilution of the fluid, which is why there will be decreased osmotic pressure. Examples of this will be renal insufficiency and failure, so which is why the body will not be able to excrete the excess amounts of salt in water from the body, and hence it will be retained inside the body, leading to edema. It can be in renal hypoperfusion, which is seen in congestive heart failure or hypovolemia. It can be seen in increased activation of renin-angiotensin-aldosterone system. If you know aldosterone, it is responsible for increased retention of salt and water in our body. So if there is increased activation of this process, this system, it leads to increased retention. It is also seen in increased release of ADH. So somehow if the release of ADH is increased, ADH is anti-diuretic hormone, so it helps in retention of water in the body. So it can also lead to edema. So this is a picture from Harsh Mohan, and it will help us to understand how different conditions in our body lead to sodium and water retention. So whenever there is hypovolemia, that is, there is decreased amount of blood decreased volumes of blood in our vessels. So that is going to lead to renal ischemia, so the kidneys will not get enough blood supply, which is going to lead to decrease in the sodium levels in renal tubules, which is going to activate the renin-angiotensin-aldosterone system, and aldosterone will be released. And the function of aldosterone, as we know, it promotes the retention of sodium and water. Then, due to hypovolemia, this is also sensed by the baroreceptors of our body due to decreased blood pressure. So it will activate the sympathetic system of our body, which is going to lead to the constriction of the arteries and arterioles, which is again going to lead to renal ischemia, so there will be decreased GFR, and hence the kidneys will not be able to work properly, which is going to lead to decreased excretion of sodium, and more of it will be retained in the body along with water. Also, when there is hypovolemia, so it is going to lead to increased secretion of ADH from the posterior pituitary. ADH is the anti-diuretic hormone, so it is going to promote the retention of water, again leading to, all of these conditions are going to lead to excessive retention of sodium and water in our body, which is going to lead to edema. So that is how edema occurs, due to excessive salt and water retention in our body. So this is another picture from Robbins, and it summarizes whatever we have learned till now, what are the different conditions that can lead to edema. So in case of heart failure, the heart is not able to pump out blood effectively, so it leads to increased capillary hydrostatic pressure, so the fluid moves out from the vessels, leads to edema. Also, because of heart failure, the kidneys do not get enough blood flow, which leads to the activation of renin-angiotensin-aldosterone system. Aldosterone leads to retention of sodium and water in the body, which again increases the blood volume, causing edema. If there is renal failure, the kidneys are not working, so that is again going to lead to retention of sodium and water, again leading to blood volume increase, ultimately leading to edema. If there is malnutrition, there is not enough protein going inside the body. If there is decreased hepatic synthesis of proteins, or if there is nephrotic syndrome in which the proteins are excessively lost. So all of this is going to lead to decrease in the plasma albumin, and it is going to lead to decreased plasma osmotic pressure. So the proteins are not going to be able to retain the fluid or draw in the excessive fluid from outside into the vessels back again. So it is obviously going to lead to edema again. Moving on to the next cause of edema, lymphatic obstruction can also cause it. So if there is impaired clearance of the interstitial fluid, it leads to lymphedema, that is edema due to impaired function of the lymphatics. Examples of this can be the surgical removal of axillary lymph nodes in breast cancer. So if the lymph nodes get involved in breast cancer, so we have to surgically remove it, and this can cause edema. Or if there's pressure from outside, if the lymphatic vessels are getting blocked due to some external pressure, so they are not able to clear this plasma out into the normal blood circulation, so it gets retained and not drained, so that again leads to edema. So if there is a rupture of the lymph vessels, it is also a cause of edema, and that is known as chylous effusion. And an important point to note here is that it is a transudate, but it is not colorless, it is milky in appearance. Why? Because it contains lipids. So when digestion occurs and absorption occurs, so lipids, out of all things, it is absorbed in the lymph, not the blood. So when there is rupture of a lymph vessel, it leads to chylous effusion, which has all those lipids in it. So the color of that transudate is milky. Another cause of lymphatic obstruction can be inflammation due to some kind of infection, and the most notable of those is filariasis, also commonly known as elephantiasis. It is infection due to a parasite known as Wuchereria bancrofti. It causes non-pitting edema of the lower limbs and external genitalia. Another example of lymphatic obstruction can be occlusion of the lymphatic vessels due to some malignant cells getting lodged. Another example can be Milroy's disease, which is hereditary lymphedema. So you inherit that from your parents. So this is the picture of filariasis or elephantiasis. You get swelling in your lower limbs and the external genitalia due to infection of your lymphatic system by this parasite, Wuchereria bancrofti. So the fifth cause of edema is increased vascular permeability. So under normal conditions, the capillary wall does not allow many of the plasma proteins to move out or leak out of the vessel. It is only if there is an injury to the endothelium that the capillary will become more permeable to the plasma proteins, and then the plasma proteins will leak out. Now, as the plasma proteins leak out of the vessels, so there is not much of those proteins left inside the vessel, which leads to decreased plasma osmotic pressure. And since there is an increase in the number of proteins in the interstitial fluid, it is going to lead to an increase in the interstitial fluid osmotic pressure. If this is the vessel and there is increased permeability of its wall, so the proteins which were initially inside the plasma, they are going to leak out into the interstitial fluid. So this is going to lead to decrease in the plasma osmotic pressure because there are lesser proteins inside the vessel now, and since the proteins have moved out, it is going to lead to an increase in the interstitial fluid osmotic pressure. And now this is again going to lead to, it is going to draw more and more fluid out of the vessel because the osmotic pressure is higher outside the vessel, again leading to edema. Now the examples of increased vascular permeability that leads to edema obviously includes inflammation, because inflammation results in formation of gaps between the endothelial cells, which obviously increases the permeability of the vessels. It can happen in systemic infections which lead to sepsis. Sepsis can cause a generalized or systemic edema, which is known by the term anasarca. Edema due to increased vascular permeability is also seen in conditions like allergy, anaphylactic shocks, insect bites, irritant drugs, and toxins. There is also a special type of edema known as angioneurotic edema, and that is due to acute neurogenic attack, and it generally affects the face and the periorbital region in particular. So that's it for this video, and in the next video we'll discuss how edema affects different organs and parts of our body. Thank you for watching this video, and if this video was even a little bit of help to you and added at least some value to your life, then please like this video and share it with your friends. And to watch more videos like this, please subscribe to my channel. Thank you.